acute pain becomes chronic and they get to the pain specialist, the patient is usually having other emotional symptoms. They may be depressed. They may be angry, and there may be feelings of guilt. They may have developed family issues because they've been complaining of pain all the time. They may have withdrawn from social activity.
Nobody seems to understand.
And nobody seems to understand the cause of the pain. They may have withdrawn from social activity. Even their work may be sort of suffering or maybe some sort of jeopardy. So there are a lot of symptoms and they're desperate by the time they get to a chronic pain specialist. This pain has been going on for a long time. Doctor, get rid of my pain.
So does that mean that apart from actually treating the pain, maybe you'll be in contact with a psychologist or psychiatrist to treat the other symptoms that have come?
Yes.
Perhaps they've been there for so long now that the person needs some sort of counseling.
Absolutely. Okay. Part of the pain specialist's major role is not just treating the pain, it's to coordinate care. You see, someone that has chronic pain, like you rightly said, will need different specialists to take care of them. Not just a psychologist to help them, to counsel them on how to cope with the pain, using things that we call behavioral therapy. Okay. You also need physiotherapists to help them, do certain exercises.
That's what we call occupational therapy, right? That's
a little bit different. Physiotherapy, occupational therapy is related to a handiwork, an actual professional or occupation.
So like if somebody is a sculptor, for example,
exactly,
and is having arthritis in the hand.
Perfect. Then he will have occupational therapy to enable him to function as a sculptor while he's having treatment for pain.
Okay.
Physical therapy is a little bit different. If you have back pain, the physical therapist or physiotherapist will teach you how to do certain exercises to strengthen the muscles in your back.
Okay. Now, this one, has there been any case in your experience where a patient has had to be told, there's nothing we can do about this pain, you've got to live with it?
That's but it happens. Unfortunately, it happens. But what we try to do is to make it possible for the patient to live with it. Not all pain can be removed and taken away and brought from a high level to zero.
Okay.
But if you come to see a pain specialist and your pain level is 7, 8, 9 out of 10, and we're able to bring it down to 2, 3, well, that's a good thing that you'll probably be able to live with. Okay. You'll be able to rebuild your family relationship. You'll be able to go out and play golf or do any exercises.
And able to think.
And able to think.
It really stops the process of thinking when you have serious pain.
Absolutely, it does. Absolutely, it does.
So, what are the methods that are used to manage pain?
Okay. Primarily, like any other condition in medicine, we have medications. Different type of medications. Muscle relaxants, not just pain medicines. Muscle relaxants, anticonvulsants, antidepressants, medicines that promote sleep, all these, anti-inflammatory medicines like ibuprofen and all those things, and strong pain medicines, which unfortunately we don't actually have enough of in Nigeria.
But should we have those strong pain medicines? Aren't they habit forming?
They are indeed habit forming, and that is a major concern of one of our regulatory bodies, NAFDAC. We have been in communication with NAFDAC. We've made an appeal on behalf of Nigerians, especially patients that have terminal illness. Okay. They should have access to these medicines. And I'm happy to say that NAFDAC is working with us to try and make this available to Nigerians.
Okay, but it's going to be strictly controlled.
Right, strictly controlled, strictly regulated because of the concern about diversion. Even in England and in America, they are controlled and they're strictly regulated. But it will take some time, but I think NAFDAC will get it done.
Okay. One of the techniques I've read about, when I was reading about pain is acupuncture. Use of needles to take away the pain.
Yes.
Now, I don't know if, most people are like this, but I know that some people think acupuncture, wait a minute, that is Eastern, it is mystic. Is it really mystic? What's it all about?
Well, 20 years ago, acupuncture was mystic.
Oh, it was?
Yes, but not anymore, not nowadays. I had some training in acupuncture when I was at the Hammersmith in England. Acupuncture now falls under a group of therapies which we call complementary alternative therapies. Okay. And scientific evidence has shown that it works.
Why do you prick somebody cause more pain to remove pain? What's the science?
Because the simplicity of it is that when you put the needle in and you twist it, it causes the body to release certain chemicals,
Okay,
which by nature, endorphins,
I did read about
they are
that.
actually pain-relieving substances themselves.
Okay.
Unfortunately, acupuncture, you have to go regularly for treatment because the effect will wear off.
Okay, but
Yes.
if somebody has an acupuncture session, for example,
Yes.
how long does it typically last?
Oh, it all depends on many factors, but it can last for days.
That's the relief.
To weeks. The relief. 2 weeks, and then the patient may come back in a month or 2 months' time and have another session. Sometimes you have a session every week for 6 weeks, and then you might have relief for 3 to 6 months. But at the end of the day, the relief from acupuncture it does work, but it's temporary.
Okay, and somebody has to really be trained to do that kind of thing, because it's like those needles go in specific spots.
Yeah, they go in certain points. They're called chai points. Chinese called chai points.
Okay.
There's a calendar. There's a map that will locate those points. You need to be trained in acupuncture before you start sticking needles. Have to be cleaned. You don't pass on infection, hepatitis, HIV. You really have to be trained and know what you're doing, because there are nerves there and there are blood vessels there, and it is not as straightforward as it looks. You have to have an escort, because the acupuncture itself, all those endorphins, can make you relax and sleepy, and you probably might need an escort to go home.
Okay,
Yeah.
let's quickly touch on back pain.
Back pain, yes.
Lots of people have back pain, especially as they get older. People talk about their lumbar. I know that so much because they talk about the lumbar, touch the lower back, you know, and all that. Then sitting. Is it that people's sitting postures are wrong? Is it that people have different sorts of backs? Why do we have back pain so much?
Well, when people ask me why, it's a very difficult question to answer why. But I can tell you what are the contributing factors to back pain. The spine, the way you posture yourself with the spine is one important cause. Okay. Age, as you also mentioned, is an important contributing factor. We have found, evidence has shown that when you cross 35, 38, 40 years old, your spine, your bony parts of your spine will start to show what you call degenerative changes. And in women, there's a type of back pain, a cause of back pain called sacroiliac joint pain, where the hip joins the pelvis. Probably because the pelvis expands, is shaped a bit differently in women, it expands in labor. Women tend to be more prone to the sacroiliac joint as a cause of their back pain. But the back pain, right now, 80% of the population will have suffered one episode of back pain in their life. And as we're talking now, probably 1 in 5 people right now will have some degree of back pain. Most of it will go away in a few weeks and it will be acute. But some can be chronic, and it's quite common, and it can be very difficult to treat.
Okay. At this point, we're going to have to take a break.
Okay.
We'll come back in a moment. We're taking a break now. When we come back, your questions and your comments. Stay with us.
Ladies and gentlemen, don't miss Africa's leading auto show, bringing you the latest cars from motor shows around the world. Check out the new Lamborghini Jeep, the latest Bentley SUV, the ultimate Ferrari ever built, the top-of-the-range Aston Martin, the Koenigsegg, the Quaigaro, the BMW i8 Spider, and the Volvo Yukon Set. You don't want to miss it. Saturday, 3:30 p.m. with your host, Akin Koka, on Channels TV.
Every day of the work week, investors buy and sell on the floor of the Nigerian Stock Exchange. Capital Market tracks and analyzes the movement of the indexes as the bulls and the bears struggle for supremacy. Follow the market from the opening of trading to the closing bell. Capital Market, every Saturday, only on Channels Television.
Welcome back. We're talking about pain management with Dr. Femi Ogunyemi, and this is the time when you can call in with your questions and your comments. The number to call is 01-2206 842. That's 01-2206 842. And we were talking about the back.
Yes, I brought along with me a spinal model, which I tend to show my patients to explain the 2 or 3 major causes of back pain to them. They will go for an MRI. The MRI will give a report, and I use this to explain to them what's going on. 3 important structures. You see these yellow things. Those are the discs
Okay.
that make